What time is it? Did that alarm clock just go off again? Can I go home yet? I feel like I barely can take any time off. I'm overwhelmed with the administrative tasks and charting that comes home after work. I get so distracted and then wonder where all the time went. Leisure reading? What's that? A little time for myself? Margin? What? If you've thought any of these things, stay tuned for the rest of today's episode. This show is for you. Welcome to the MedEdWell Podcast, where physicians get empowered to take the next step in their wellness, personally, professionally, and financially. I'm your host, Dr. Ryan Stegink, a practicing general pediatrician and online entrepreneur. Thank you so much for joining me here on the MedEdWell Podcast for this, the 4th episode. I have been so encouraged to hear from a number of you. You have shared feedback and how this has been helpful to you, and I'm encouraged to press on in exploring these topics with you. Today's episode is the first of 2 episodes examining margin. You know, the extra space that exists on certain papers, or the shoulder of the road so you potentially don't fall off if you needed to pull over. Well, our discussion of margin will examine 2 distinct yet interrelated aspects of margin in each of our lives: time and money. Today we will talk primarily about time, and the next episode about money. You will hear stories from my journey and have opportunities for reflection, where you may have margin or where you may need more of it. Before we dive in, let's hear about today's sponsor. Disability insurance is complicated. Doctors shouldn't have to take time to sort through a bunch of insurance quotes to find the best policy. Don't stress over insurance shopping. Let Pattern find the best coverage for you at the most affordable price by visiting patternlife.com/MedEdWell. The link will also be in the show notes. As an additional disclaimer, while everyone's situation is different, and this podcast is not specific financial advice, but rather for your education and entertainment only, disability insurance is for those of you with an income to protect, and typically not for those of you in medical school. All right, now back to today's show. So back as a child, I thought time moved so slow. The school year seemed like it would never end. And yet, elementary school, middle school, high school, college, med school, they all passed by, and here I am, wondering where all the time went. A friend of mine recently told me, "You'll never be less busy or have less responsibilities than you do right now." Looking back, I can see this to be true. Even in medical school, I had to study, and study hard, but I was still able to make time to spend with friends and family. I played saxophone in a band every couple months. I was able to take a study break and go ride my bicycle on the Chicago lakefront. As an aside, if you haven't done that, or at least walked along the lakefront path, I would highly recommend it if you get a chance to visit. Not to say that med school was easy. It wasn't. But looking back, I was single, no kids, and had freedoms that I don't have now. In med school, I was able to do a 6-week family medicine rotation abroad. Now, with a family, being an attending, I have been blessed with new opportunities and new responsibilities. So time is valuable. You can't get it back, and you can't make more of it. Sometimes we think we can use productivity hacks or use systems to achieve what we want. Correction, what we think we want. We think we can always squeeze more out of the day. And yet, sometimes that removes any extra space, any margin. When margin decreases for each of us, many times it is easy to let the healthy habits get crowded out. That could mean less sleep, less activity, and exercise. It could mean more consumption of unhealthy foods, more thoughts that are unhelpful and discouraging as things continue to pile up. Less time with friends or family. The list could go on, but you get the picture. These are some of the things that, when thoughtfully addressed, can be helpful in one's pursuit of wellness. Things that are important, but not urgent. Let me tell you, in general, many of these things are challenges for me, even now. sleep, exercise, mindful eating. This is particularly true after a long day or a long week as a physician in medicine. This lack of margin and healthy habits were issues for me as I found myself in the worst of my burnout. I still know that the primary causes were the system inefficiencies, time pressures of seeing patients so close together, and charting. Charting at home, charting in the evening, charting the next day, charting on the weekend. You know it's true. It's exhausting. As I mentioned in the first episode, my first year out of residency, I was a particularly productive, hard worker. I had a long stretch of shifts that February, with a combo of newborn nursery rounds and coverage at the hospital, with separate clinic days. Altogether, this was about 11 or 12 days in a row. I finished, and I learned a lot from being and attending on the wards for the first time. But I was exhausted, not able to fully recharge after those days, even with the subsequent weekend off. It was not long before I found myself on the couch with my wife, and her telling me, something has to change. So let's back up for a minute. Margin, as a construct, can be threatened and attacked from so many angles. There was the learning curve of being a new attending and junior faculty, looking up more medication doses, reviewing my differential a little more, finding characteristic images of particular rashes. Does this patient look more like this photo or that one? Figuring out my flow with 8 to 11 patients per half day, rather than the 5 to 7 at most that I would see in residency. And in residency, that was only 1 half day a week, not 9 of them. So many things eating into my time at work when I'm trying to get things accomplished. Medical knowledge, clinical flow, charting. From a professional perspective, those are all things that every physician and physician in training has to figure out. These are some of the things that I cover when working with medical students and residents. I regularly have residents with me 1 half day a week as they come through on a couple of rotations. It can range from a new intern to a resident who is mere months from graduation. I send them in to see the patients first, and for some patients, I know they may be in the room for a while. Medical or social complexity, a chatty personality, it could be anything really. But I sometimes know that in advance, and I'm really thankful for the increased continuity when compared to my resident clinic. Continuity is often difficult in today's environment with the emphasis on patient access, but I digress. Another topic for another episode. So I send in the resident, and for those that are close to graduation, I give them a long time before I or my nurse knocks and checks in on them. They are almost done with residency and need to figure out their own flow and how to get from one patient to the next. Speaking of residency and trainees, I wanted to interrupt this episode to let you know about something super exciting coming up soon. It is my free webinar entitled Financial Wellness in Training. Designed for physicians in training, residents, and fellows, this webinar will cover financial topics relevant to this season as an early career physician. From insurance you may need, to retirement accounts, to student loans, to planning for the future. Come and learn how to take the next step in your financial wellness. Get more details and register today at the link in the show notes. Space is limited, so save your seat today. Back to my story. In my first year out of residency, I was still figuring out my flow as a new attending. The big challenge was, and often still is, how much of the note can I finish in the room or shortly thereafter? I can see a bunch of patients with fewer of my charts done and manage to stay closer to on schedule. But more notes would pile up, eating into my margin. I love people, and I enjoy the opportunities to interact with my patients and families at work and to spend time with family and friends outside of work. But at the same time, I'm an introvert at heart. I get energy from being able to read a book, to work on the more or less intro to coding platform that is iOS shortcuts, to play the piano, to spend time in nature. Having space or margin for these things is really important for me and my wellness. Creating margin often looks different in different seasons. There are certain fixed responsibilities, work, family, or otherwise, some that you may be able to change, and others that appropriately take precedence. Other things creep onto the schedule that may or may not be as high of a priority for you. They also may not be as life-giving. And yet they are easy and often require less energy or engagement. Checking the news, sports, social media, video games, any other thing that you can come up with. It's an issue for me too. Just ask the screen time report for my phone and tablet. I consistently need to look at what my true priorities are, then evaluate the things I have to do, and finally, look at what space I need and restorative activities to schedule. This will often include planning a number of things in advance. I'm pretty good at collecting tasks and documents, things to do in my task management system. It's the overwhelm and desire for comfort that often impairs my follow-through. So what could that look like to make some of these changes? It could mean scheduling some time to have a phone date with a friend or family member you haven't talked to in a while. It could mean asking for things that could help you at work, whether adjusted system templates for documenting, or potentially an adjusted schedule some days so you could actually make it to your kids' after-school event. Planning some of these things is really important. Rest, exercise, and other life-giving things. For me as an attending, it may mean actually scheduling some of these things. Yes, like exercise, Ryan. I still need to get better at that one. That way, these things still happen, even if I do have to bring notes home. If you are a student or resident, maybe your hours are longer on a particular rotation. It's really challenging to come home tired and wanting to relax, but still needing to help out at home, while also wanting to read about your patients. Not to mention finding time to study and do practice questions for the tests that never seem to stop. When you can, you may need to schedule some of these self-care things farther in advance. And by the way, that's just not possible sometimes. Life just happens. I remember how hard it was to schedule my routine dental cleaning when the days off on ward months were never weekdays. Or hobbling around the neonatal intensive care unit, just trying to finish early so I could go to the employee health clinic to get my infected ingrown toenail assessed. It hurt like crazy. I was seriously limping. And these types of things are a reality sometimes. Not being able to have the flexibility to deal with these things is a big stressor and negatively impacts wellness. For me, more margin at work initially meant cutting to 8 and then 7 sessions rather than 9. However, more recently, I had the opportunity to continue advocating for myself. I have desired to be at a single clinic since I started at the system out of residency, which at the time of this recording was over 5 years ago. I was told that the system needs meant my time needed to be split initially among 2 clinics. At one point, it ended up being 3. But I had recently attended the White Coat Investor Financial Literacy and Physician Wellness Conference earlier in 2021. While attending virtually, I heard Dr. Linda Street's talk on nailing your next negotiation, and I was equipped with newfound skills and confidence in myself. This was put into practice mere weeks later when I had the opportunity to approach a leader in my group about consolidating my time at one clinic. I obtained my visit data and made my case in terms that showed how my request could align with system goals. I even advocated for others, suggesting ways we could have a 3-clinic trade of physicians that would increase continuity and make the physicians more satisfied in their jobs. No, we can't accommodate that at this time based on the system needs. But a month later, I was able to talk with leadership again as a new physician was scheduled to start in a few months at one of the clinics. Realizing mid-conversation that an immediate transfer for me was not going to happen, I pivoted. Well, could we close my schedule at the one clinic when the new physician starts and open my schedule at the other clinic as of that date? After some leadership discussions, I was told that could work, and it happened. All that to say, self-advocacy and negotiation can work, but keeping those lines of communication open is really important. Also, figuring out where the leverage is. I knew my numbers at the desired clinic were higher, which aligned with system goals of seeing more patients, more access. And yet, while my fragmented clinical time did add some stress at work and was a dissatisfier for me personally, I had good colleagues and staff at each place, and I wasn't ready to quit over it. And yet, now a month into being all at one clinic, I find it helpful for me. I can see patients back more often in a couple of days, if that's clinically indicated, because I'm on site 4 days rather than 2 at each of 2 clinics. I can leave my stethoscope and supplies in my locker, and I get to see and talk with colleagues and staff more opportunities for continuity, less complexity in my schedule, my paperwork. These are good things. Then, let's look at time margin at work from a macro level. A word for all the employed docs out there like me. Take your PTO. Take it all. Don't leave it sitting there. It's called paid time off, after all. Commit yourself to being proactive. Taking your time off may just include putting a couple weeks or random days on the schedule a few months from now. Whether your system prefers 60 or 90 days notice or something else, having some on the books early makes it easier to switch later. Typically, there's then more availability into which staff can reschedule your patients. You can often give some time back if needed as well. My schedule will usually fill if opened a few days or a week in advance. I keep track of my own time off on a Google Sheets spreadsheet, and this tracking allows me to keep an accurate track apart from my human resources portal, which may not have everything entered yet that I have requested. Now I know what you're going to say, but then I may not hit my productivity target. If you don't hit the threshold for visits, or in other cases many still using work RVUs, what happens? Do you go below a particular base salary? It comes down to understanding how your contract and compensation plan are structured. For so long, physicians, including myself, were like, I'm going to be a great doctor, practice medicine, and get compensated, rather than digging into the details of these compensation plans and advocating accordingly. If there is a base salary, sometimes you could have a higher base if you had a sustained increase in your productivity, say by adding extra procedures or not taking all your time off. You got the bonus consistently and were up for the base increase. Then maybe you understand that you deciding to take your time off will mean that you get bumped down a tier next year or whenever your employer reevaluates it. For me, as an employed physician, I said bonus is bonus, and it was extra margin for me when I didn't meet my goals when I took time off after the birth of my daughter. It was totally worth it. Financial margin like that can be super helpful, and something I'll talk more about on the next episode. If you are in private practice or have a solely production-based contract, figure out where you need to be for production relative to your priorities and make sure that you get the time off that you need. So to wrap up today, take a moment and reflect. What do you do with time away from work? How do you want to plan your time on a weekly basis? A monthly basis? Say the whole year? Take the big things first, and then fit in others around them. Plan things in advance. Restorative activities, reading, self-improvement, exercise, sleep, relationships, mindfulness, meditation, or religious practices. These are part of the why behind margin. Then for more of the macro view, taking your next step towards wellness. If you're out of training, look at your time off balance. Look at the time you need to schedule off and just adjust your own expectations of your productivity. Then make a plan for the rest of the year. It can be a rough plan, but commit to putting some additional dates on the calendar this week, even if you have to move some of them later. Regardless of whether you're still in med school, in residency, fellowship, or afterwards, go ahead and look at your calendar. When is that next break or time off, and decide what you want to do. It could be connecting with family, taking a hike, reading that book you've had on your shelf, or going somewhere to get out of town. Whatever it is, write it down and tell someone about your commitment. To sum it up, find the time, decide what to do with it, and seek to create margin in your schedule. Then, by intentionally using your margin, you can do things that are both priorities and support your wellness. Take that next step today. If this was helpful to you, please subscribe, share with a friend, and leave a review. Check out the registration for the upcoming free webinar, Financial Wellness and Training, at the link in the show notes. And if you need a disability insurance quote, check out today's sponsor, Pattern. Again, thank you so much for joining me for another episode of the MedEdWell Podcast. And please join us again on the next episode as we talk about margin and finances as a physician. Have a great day. And now for our important disclaimer. Dr. Ryan Stegink is a practicing general pediatrician, but the MedEdWell Podcast does not reflect the views, opinions, or belief of his employer nor his affiliated university. Additionally, the MedEdWell Podcast is for educational and entertainment purposes only and should not be considered advice regarding financial, legal, student loan, medical, or any other specific topic. In such a case, you should seek consultation with a certified professional in that particular area. Again, thanks for joining us on the MedEdWell Podcast, and have a great day.